previously we have started with the introduction class. Okay, so we have started with the introductory class, and now the first part of your final year periodontics topic. Okay, it comes with basics of anatomy of oral structures. Okay, so first and foremost important part what we are dealing with in perio department. Okay, consists of it is mainly gingiva. Okay, so periodontium, the term itself implies that structures which are present around the tooth, and by the structures around the tooth, meaning it comes to gingiva, ulnar bone, periodontal ligament, and cementum. Okay, so these are the four structures which will be constituted in periodontium. Okay, gingiva, ulnar bone, periodontal ligament, and cementum. Okay, cementum also comes under periodontal structure only. Okay, because if you see the origin and all will be different from tooth. Okay, so for coming to the first part of the periodontium, which is known as gingiva. So, what is the basic anatomy of gingiva and what are the various parts of gingiva? Okay. So, anatomically, it is classified into three main parts. Okay. So, the three main parts are free or marginal gingiva. Okay. I will show you the pictures of how these things will look. Attached gingiva. Okay. So, first one is the free gingiva. That means it is not attached; it is free. Whereas the second one is the attached gingiva, which is tightly attached to the underlying mucoperiosteum. And the third one is the interdental gingiva, that is the gingiva which is present between the teeth. So these are the main basic parts of a gingiva anatomically. Okay, whereas functionally, if you see, it can be easily classified into the part of gingiva which is facing the oral cavity. Okay, that is exposed to saliva and all the food and everything, and the part which is facing the tooth. Okay, so I will show you the picture of what it is. Okay, so you have to remember this particular diagram. So whenever a question comes from gingiva, you have to draw this particular cross section of your tooth. Okay, so these basics you have already heard of in your previous year. Okay, so this is the okay. So see this. So this is the enamel. This is the dentin. Okay, so up to here is the crown part. From here is the root part, and the root part is covered by cementum. Okay, and your gingiva will be present from your enamel. Okay, so just 2 to 3 mm above your CEJ, your gingiva will be present, and from there your entire periodontium will start. Okay, so the tip from the tip of the gingiva, crest of the gingival margin, to the base of the gingival sulcus. Okay, so this red color part. What you are seeing here is the gingival sulcus. Okay, so if you want to classify these particular parts, so from here to base of the gingival sulcus. Okay, so this part is free; it is freely movable. There is no attachment between the tooth surface and the gingiva here. Okay, there is a space between the there is a space between the tooth surface and the gingiva. So this part you call it as free gingiva. Okay, so free gingiva extends from gingival margin, crest of the gingival margin, to the pre-gingival groove. Okay, so base of the pocket is externally, it represents as pre-gingival groove. Okay, it's not observed in all the persons. Okay, pre-gingival groove is not visible in each and every person. Okay, so how do you measure the base of the sulcus? Is through using a calibrated probe. I will tell you how to do that. Okay, and the next part from where your attachment starts. Okay, see here, from here the attachment has started. So from here to the alveolar mucosa. Okay, so alveolar mucosa, you can clearly differentiate between the your attached gingiva and alveolar mucosa. Alveolar mucosa is again free. Okay, it will be loose. Whereas, see this retipex. Okay, so these are tightly attached to the underlying connective tissue. So this particular gingiva, which extends from pre-gingival groove or from the base of the gingival sulcus to the mucogingival junction, is known as attached gingiva. Okay. And so if you the other classification tells about the part which is exposed to the oral cavity. That means this is the part of gingiva which is exposed to the oral cavity, whereas this is the part of the gingiva which is exposed to the tooth surface. Okay, so this is the basic classification. Marginal gingiva, it is terminal edge or border of the gingiva, okay, surrounding the tooth like a collar. If you see this particular gingival sulcus, it will cover the entire surface of the tooth like a collar. Okay, usually it is 1 mm in wide. Okay, but it can be there up to 2 to 3 mm. So up to 3 mm, the free gingival margin can be there 1 to 3 mm. Okay, so demarcated from the attached gingiva by a shallow depression called as free gingival groove. So this is known as a free gingival. So you can